Hello everyone and welcome to this lesson on tuberculosis, or TB for short. This is the next infectious disease we're going to be covering. Now, the thing about TB is that it is distributed worldwide. Tuberculosis is endemic in most countries. That being said, in developed parts of the world, TB is a lot less of a problem now than it used to be because living conditions and healthcare systems have improved over time. Now, the causative agents of TB are rod-shaped bacteria of the genus Mycobacterium, specifically Mycobacterium tuberculosis and Mycobacterium bovis. The Mycobacterium tuberculosis usually causes TB in humans, while Mycobacterium bovis is usually the causative agent of TB in cattle. The word bovis comes from bovine, which means cow. That being said, it's important to remember that even though Mycobacterium bovis usually causes TB in cattle, it can be transmitted to humans as well. And this will be either through undercooked meat or by drinking unpasteurized milk. This is why things like cooking your meat through or making sure you have pasteurized milk are important in order to prevent this kind of transmission. Mycobacterium tuberculosis, on the other hand, is a droplet infection, meaning it's spread through airborne droplets that are released when a person who is infected either coughs or sneezes, for example. These droplets can then be inhaled by uninfected individuals, and this is how the spread is going to happen. Now, sometimes in your exam, the examiners will throw you a curveball by asking you about a different disease that has the same mode of transmission but isn't part of your course. For example, they could give you a question about a disease that you haven't covered, such as whooping cough, for example, telling you that it is a droplet infection that is transmitted in this same way as we're talking about, and then asking you questions based off of that. If this kind of question comes up, don't panic. Remember what you've learned about droplet infections in general, and you'll be able to answer the questions that they put to you. Okay, that aside, let's come back to what we were talking about. Now, these bacteria have a cell wall that is rich in lipids, and this lipid-rich cell wall prevents the bacteria from drying out in the air, allowing them to survive for long periods of time until they're inhaled. Because this is the mode of transmission by which TB spreads, it tends to spread most quickly when people are living in overcrowded conditions. So, for example, in communities with a very high population density, or for example, in a situation where you have a bunch of people who have to sleep close together in a closed space with poor ventilation, these kinds of situations will make the spread of TB much more rapid. Once the Mycobacterium tuberculosis has been inhaled, the organs that it usually targets are the lungs. This is going to be the most common organ involved in tuberculosis, but sometimes TB can also affect other organs, such as lymph nodes, or your bone, your gut, and even your brain. Once a person becomes infected with the bacteria, sometimes they develop the disease quite quickly, while other people may not develop the disease for many years. In these people, the bacteria remains inactive. It's only the infected people with the active form of the disease that are able to transmit it. It's only these people who are going to release the bacteria when they cough or sneeze in the form of the tiny droplets that are going to float through the air. The people with the inactive infection do not spread the disease. Now, when the bacteria are inactive, then as one would expect, the person doesn't show any symptoms. But when the bacteria are active, meaning the person has an active infection, then symptoms do arise. Now, TB is what we call a chronic infection, which basically means that very often when the symptoms do arise because the infection is active, they last a very long time. The main symptom of TB is going to be a persistent cough that lasts at least 2 weeks. This makes a lot of sense because remember, the main organs that we said the Mycobacterium tuberculosis were going to target are the lungs. This cough is often associated with the production of sputum that has blood in it. Besides this, some other common symptoms of TB are fever and a suppression of the appetite. They just don't feel hungry anymore. Because of that, people with TB also tend to lose a lot of weight and end up looking very thin and weak. These are the kind of symptoms that we're going to see in someone who has the active disease. And remember, it's these people who have the active disease that are going to be able to transmit the disease to others. Okay, so we've gone over what the causative agent for TB is, we've gone over the mode of transmission, and we've gone over the signs and symptoms of the disease. Now, let's talk about what happens once the TB bacteria enter your lungs. Let's imagine to start that you have a healthy individual who is going to be exposed to the Mycobacterium tuberculosis. When the bacteria reach the alveoli of this person's lungs, they will encounter certain white blood cells called macrophages. These macrophages that reside in the alveoli are aptly named alveolar macrophages. These are phagocytes, meaning that they're going to attempt to engulf and kill the bacteria. In many cases, this might be successful. But sometimes the best that these macrophages can do is to just sort of trap the bacteria there in one place so that they're unable to spread and cause any symptoms. This is what gives rise to what we referred to earlier as the inactive infection. These people are infected with the Mycobacterium tuberculosis, but the bacteria have been trapped in one place and are unable to cause any symptoms. Now, if at some future point this person's immune system becomes weakened because, let's say, maybe they have malnutrition, or perhaps they got infected by HIV or some other disease that suppressed their immunity, these bacteria can then break free and start multiplying and cause the disease. This could even happen years later. As soon as the immune system gets weakened, the bacteria seize that opportunity to strike, and the dormant infection becomes reactivated. Now we have an active infection, and the bacteria will start to damage the lung tissue. This leads to the formation of what are called cavities in the lungs, and they can be seen on an X-ray as these white patches here. This is why, when it comes to the diagnosis of TB, getting a chest X-ray can be quite useful. Besides this, TB can be diagnosed by examining a sample of the sputum under a microscope to look for the bacteria. Now, if this active disease remains untreated, the bacteria can move beyond the lungs and enter the bloodstream, and from there spread to many other organs. As we mentioned, some examples could be the lymph nodes, the bone, the gut, and even the brain. This is why early and effective treatment of TB is so important. Now, we already know that TB is caused by bacteria, and so the treatment of this disease is going to be using antibiotics. Typically, when it comes to TB, instead of just using one antibiotic, we usually use a combination of multiple antibiotics at the same time. You don't really need to know the names of the antibiotics that are used for TB, but for those who are interested, the commonly used ones are rifampicin, isoniazid, pyrazinamide, and ethambutol, commonly remembered by the mnemonic RIPE for the first letter of each of their names. The reason we use multiple antibiotics instead of just one is that if we were to use just one antibiotic, there is a much greater chance that the bacteria will develop resistance against that antibiotic, meaning that the antibiotic will no longer be effective. By using a combination of antibiotics, we reduce the chance that the bacteria become resistant. You see, when you use multiple antibiotics, even if the bacteria become resistant to one of them, they can still be killed by the others, and the chance that the bacteria become resistant to all four of the antibiotics is very, very small. The reason we want to avoid antibiotic resistance is that because once the bacteria become resistant to the antibiotic, that antibiotic will no longer be able to kill those bacteria. The bacteria that aren't resistant will still be killed by the antibiotic, but the resistant ones will survive, and they can then grow and multiply and eventually prove fatal for the person. This is why we use multiple antibiotics at the same time to reduce the likelihood that resistance will develop. Now, the treatment of TB is a long one. It takes a long time to kill the bacteria, about 6 months up to 9 months, or even longer in some cases. Because of this, it's quite common for people to not actually finish their course of antibiotics, because as soon as they start to feel better, they think, well, they're cured, so they drop the treatment. This is a problem because these people, although they feel better, may still have drug-resistant bacteria in their body, and they can spread these to others. Now, as we mentioned, when a person gets infected with Mycobacterium tuberculosis, it's a lot more likely for it to cause a serious disease in that person if they are already in an immunocompromised state. Examples of this kind of thing would be someone who is infected with HIV, someone who has malnutrition, or some other disease which causes their immune system to be suppressed.
Quick pause. If you're finding value in this explanation, there's so much more to discover at Alt Academy, where we break down every A-level concept with the same clarity. Now back to the video lesson.
In fact, the rise in the number of HIV cases as of late has been closely followed by a rise in the number of TB cases as well. You see, when a person's immune system is weakened, they have a lot more trouble fending off infections that maybe a healthy person would have been able to defend themselves from. However, since their immune system is weakened, they can't do that, and they end up getting a much more serious infection. Infections that have a hard time causing disease in someone with an intact immune system, but will quickly seize the opportunity to cause disease in someone whose immune system may be compromised, are often called opportunistic infections, and TB is one of these. In fact, TB is often the first opportunistic infection to affect people with HIV. This opportunistic nature of the Mycobacterium tuberculosis is one of the reasons that TB has been such a difficult disease to control. The other reason is something that we already touched on before: antibiotic resistance. TB that is resistant to at least the two main first-line drugs, namely isoniazid and rifampicin, is called multi-drug resistant TB, or MDR-TB for short. Strains of TB that are resistant to not only the first-line drugs, but also the drugs that are used to treat the MDR-TB are known as extensively drug-resistant TB, or XDR-TB. These strains of TB do not respond to standard TB treatment and need to be treated with drugs that are much more expensive. They also take a lot longer to treat, where the standard TB treatment is around 6 months. Treating XDR-TB can take 2 years or even longer. Seeing that these resistant strains of TB can be so troublesome, we need a way to make sure that people take their medicines for the entire duration of their course. In line with that, the World Health Organization, or WHO for short, promotes a scheme to make sure that all the patients take their medicines for the entire 6 months, 9 months, whatever it may be, that they have been prescribed them. This scheme is called DOTS therapy, or direct observation treatment short course. As the name suggests, this is going to involve someone directly observing the patient take their treatment. This could be a healthcare worker or a responsible family member. Either way, this person is going to be responsible for making sure that the patient takes their medicine for the entirety of their course. DOTS therapy has been quite effective in helping to reduce the spread of these resistant strains of TB. Okay, so that was a little bit about how we're combating antibiotic resistance in TB. Now, let's switch gears for a minute and talk about how we prevent a patient who has tested positive for TB from spreading it to others. You see, if a patient is confirmed to be TB positive, then What is ideally done is that that patient is isolated at 2 to 4 weeks of their illness, because this is usually the stage in which they're most infectious, meaning most likely to spread it to others. This is going to be particularly important if they're infected with a drug-resistant strain of TB. This isolation, ideally, is done in a negative pressure room, meaning that the air pressure inside the room is going to be lower than the air pressure of the environment outside. This prevents the contaminated air from the room from escaping and mixing with the air outside, and therefore spreading the disease. Now, while this patient is in isolation, whenever anyone enters their room, such as a healthcare worker for example, we're going to make use of personal protective equipment, or PPE, to prevent the spread of the TB from the patient to the other person. Typically, this means that whenever someone enters their room, both the patient and the person entering should be wearing a mask, and the person entering the room typically is wearing an N95 mask as a common example. In addition to this, once you know that a person is positive for TB, we need to also do what is known as contact tracing. This is exactly what it sounds like. We will trace the people who our patient has been in contact with and screen them to see if they've been exposed to TB. You see, some of these people may have been exposed and have an inactive infection, meaning that the bacteria are dormant. They have a latent TB. These people can be treated preventatively to diminish the chance that their TB ever becomes active. And if some of the contacts do show symptoms, early treatment can help them have better outcomes. Now, when it comes to screening people to see if they've been exposed to TB, one of the ways that this can be done is by using TB skin tests. Examples of this are the MAN2 test and the HEAF test, the latter of which isn't used anymore, but the concept of both of them is pretty much the same. Basically, a small amount of proteins from the bacteria are injected just under the skin, and then you watch to see how the body reacts to it. The person's immune system will recognize those proteins as being foreign, and there will be an inflammatory response that will be visible on the skin after a few days. The area where you injected the proteins will appear red and sort of thickened or crusted. Now, by measuring this area, you can get an idea of whether or not this person has been exposed to TB. Remember, if a person has already been exposed to something, then their immune system will mount a secondary immune response if they encounter that particular thing again. This secondary response is a much more potent one, and so if the person has been exposed to TB before, the diameter of this area will be greater. Now, of course, this test isn't perfect, and the results can be misleading in a number of different situations. For example, if a person has received a TB vaccine, which we'll talk more about in a minute, then that person's immune system will mount a secondary immune response even though they don't have a latent disease. On the flip side to that, if a person's immune system is weakened or suppressed, then it won't be able to mount a powerful response even if they do have the latent disease. So you won't see a large diameter of this area even though they have latent TB. So, while these skin tests are indeed useful, their interpretation needs to be done a little carefully. Okay, so based on what we've talked about so far, what are the ways that we can control TB? One of them is early diagnosis, by using, for example, a microscope to look for the bacteria in a person's sputum, or by getting a chest x-ray. Once we see that a person has tested positive for TB, we can use contact tracing to make sure that anyone they were in contact with who was exposed is treated promptly. Then, since we know that TB spreads better in overcrowded conditions, we can make sure that there is proper housing, and that the houses are not only not overcrowded, but also well ventilated. Another thing that makes people more vulnerable to infection by TB is having a weakened immune system, And a very common reason that people might have a weakened immune system is if they have malnutrition. So making sure people have access to good food and a good diet can help prevent the spread of TB as well. Aside from all this, we also have a vaccine for TB, which is the BCG vaccine. BCG stands for Bacillus calmette-guerin, which I might be saying completely wrong, but here we are. This is a live attenuated vaccine derived from Mycobacterium bovis. When this vaccine is given to a child, the immune system reacts to that vaccine and develops immunological memory by forming memory cells. We talked about how this kind of thing happens in our lessons on immunity, so if you're unsure about this, feel free to go back and revise that before continuing. This vaccine protects 70 to 80% of people who receive it, but as the person gets older, the effectiveness will decrease. Remember, immune memory wanes over time, so unless the person is being repeatedly re-exposed by the Mycobacterium, their immune memory will decline as they age. One last thing to know about this vaccine is that it's typically only used in countries that have a very high rate of TB. Places like the US or the UK typically don't use the BCG vaccine as part of routine immunization. Instead, it's only given for a child who would be at a very high risk of getting the disease. For example, if they live with someone who is currently being treated for TB. Okay, so far we discussed that the causative agents for tuberculosis are Mycobacterium tuberculosis and Mycobacterium bovis. The M. tuberculosis is transmitted by droplets, and the M. bovis is transmitted by either eating raw or undercooked cattle meat or drinking unpasteurized milk. The main symptoms of the disease are a cough, which may or may not be associated with blood-stained sputum, fever, and weight loss. Treatment is typically done with a combination of antibiotics, and prevention is typically done by using the BCG vaccine in children. We prevent the development of antibiotic resistance using DOTS therapy, where a person is assigned to make sure that the patient takes their medicine throughout their entire course. Then, if a person tests positive for TB, we use contact tracing to make sure that anyone who may have been exposed is treated promptly. Now, we have only one last thing to look at before we conclude this lesson. This is a graph showing the changing trends in the death rate from TB over the years. As you can see, the death rate has been steadily declining from the 1900s all the way up to around 1940, and this is attributable to improvements in housing provisions and diet for the poorest people in society. Then, after around 1940, we see that the death rate starts dropping even faster. This is around the time that the first anti-TB drug treatments were discovered. Next, as we approach the 1960s, we see the death rate continuing to go down. This is around the time that BCG vaccines were commonly starting to get used in immunization programs. Most recently, though, as we start to approach the 2000s, we see the graph start to creep upwards again. Part of this is possibly due to globalization of population movements. People from one part of the world can easily be exposed to people from another part of the world. Another reason for this upturn is the increase in antibiotic-resistant TB. All right, with that, we have reached the end of this lesson. I hope you found it useful, and I'll see you next time.
Hey there! If you found this A-level biology lesson helpful, why don't you head over to altacademy.org and sign up for our full A-level biology course. In addition to biology, you could sign up for physics, chemistry, math, or 4 other A-level subjects. Thousands of students have already taken the leap. What are you waiting for? See you there.